Dr. Chamisa, welcome. Now, doctor, you are a very well-known expert in the management of piles. Many people are not sure what piles are. Can you tell us what are piles?
Thank you, Marcelo, for the invitation. So piles or hemorrhoids means abnormal or swollen veins, mainly around the anus and the rectum area. And there are two types of piles, what we call internal piles and external piles. The internal ones are inside the anus, external they do come outside. And I would say more than 70% of our patients, they do present with a problem of piles in our clinic.
Okay, doctor, are there any known causes for piles, or do they just come out of nowhere?
Well, basically piles, there is no known specific cause for it, but we do know that there are several risk factors for developing piles or hemorrhoids. Basically, any people with problems of straining or difficulty in passing stools over a long period can develop piles or hemorrhoids. And also any patients with a chronic constipation or who take too long time in the toilet passing stools over a long period will develop piles. But the main underlying cause is any increased pressure around the anus or the rectum will result in piles over a long period.
Does the same apply to people who pass gas often?
Well, that's something different. Passing gas too often may be a condition of the rectum or the colon, but not necessarily piles, something completely different. For piles, just mean the veins in the anus or the rectum. And some people do have symptoms, some do not have symptoms with the piles.
Okay, doctor, are there any ways of preventing piles from happening or from getting worse?
Well, up to now, there is no known ways of preventing piles, but certainly prevention is better than cure. And the best way is to try and maintain a regular bowel movements. And there are several methods of doing this. This includes things like regular exercises, drinking lots of water. You can see I'm drinking water here.
Yes.
Usually up to 6 to 8 glasses of water per day will help with that. And also diet comes in as well. Any diet high in fiber will help you to have a regular bowel movements. So basically it's more of a lifestyle disease. And if you change that, you can prevent getting piles or hemorrhoids.
Okay, doctor, what symptoms or complaints do these patients complain about?
So many patients with piles, the most common complaint is bleeding from the rectum. That's the most common complaint. And usually it's a bright red bleeding. And sometimes they say when they wipe themselves, they see some blood stains. That could be a sign of piles or hemorrhoids. Besides that, they can also have symptoms like discomfort or even itchiness or discharge around the anus and rectum area. But the most common is bleeding at the bottom.
Does this bleeding happen randomly, or is it when they go to the toilet?
Well, the most common time to bleed is when they pass stools. That's the most common time. But sometimes they can also bleed without going to the toilets. But whatever it is, any bleeding needs to be investigated to rule out piles or serious body conditions.
Doctor, can you explain the different ways of treating piles?
So we do have different options of treating piles, and it depends on the grade of the piles. There are 4 grades, 1 to 4. 1 being the least severe and 4 being the most severe one. So the options depends on the grade of the piles. And the options also depends on the complications of the piles. But the options include diet management or lifestyle changes. That's the best way to avoid and treat piles. The second one, there's something called a bending of piles. We do some small bends around the veins so that they can shrink as time goes on. This is the minor office procedure. It takes about 5 minutes to be done, and it's no complications, no risk. And thirdly, there's something called a sclerotherapy. And basically this means injecting some chemicals into the veins. And over a period, these veins also will slowly shrink and disappear. And the third option is we can use something called a radio frequency ablation or radio frequency laser to try and bend the piles away. And lastly, there's an option of doing a surgery called a hemorrhoidectomy. So this basically means to remove the piles by surgical means. So these are the options we use for piles.
Okay, doctor, I can imagine that patients are generally scared of surgery of piles. Why is it so? And do you offer any special treatment is there any other option other than just having to go for surgery?
Yes, most patients I've realized are so scared of surgery for piles. Once you mention it, you scare them away. And I'm not surprised with that, because in the past we used to use major surgical procedures to remove piles called hemorrhoidectomy. But nowadays we've developed newer technology to treat piles. In my clinic, we use something called radiofrequency ablation or Raffaello procedure. It's a procedure where we use radiofrequency to treat piles. Now, the beauty of this technology is that it's an office-based procedure. You walk in, walk out the same day. It takes 20 minutes. It's almost painless, and there are almost no complications or no recurrence. So this is a new technology which I advise patients to come and see in our clinic. And as far as I'm aware, in Pretoria, we are the only clinic offering this kind of treatment.
I'm sure there are those who are glad to hear that kind of information.
We are waiting to hear from them.